You must fight.
Where we already spend the most, okay? We have enough money to provide health care to everybody. We have health providers, we have hospitals, but we don't have a system, and so we don't take care of our people. We could be the best. Why can't we be the best when it comes to health care? Why can't we care about each other? Dr. Quentin Young, many of you may know, one of the co-founders of Physicians for National Health Program, who is also the Reverend Dr. Martin Luther King's personal physician and walked with him in his marches, recently said, it's time to use what President Obama said back in 2006, start from scratch. It's time to start from scratch. We have been trying for decades now to prop up this system and patch it up what we have here, and it's not working. It's time to ditch it and start from scratch and build a national single-payer health program.
Health. I am also a psychiatrist. And I can tell you that every single patient that I have seen in the last several years is suffering from an anxiety disorder. And I've given that anxiety disorder a name because I couldn't find it in the DSM-4. The name of that anxiety disorder I've given, it's an acronym, it's called PIST. So I'm mad because my patients are pissed. And what PIST stands for, it's P-I-I-S-D, is Private Insurance Induced Stress Disorder. I don't know whether the American Psychiatric Society Association will allow it to be introduced into the DSM-5 that's coming out, but I think it should be, and with your support, maybe we can get it in there. More importantly, maybe we can cure this condition of PIST. And the cure for it is what everyone is doing here today, standing up, taking action, letting Congress and letting President Obama know that we're mad as hell and we're not taking it anymore. Thank you.
No, me either. I mean, I'm trying to get it to dry.
Yes, we're hoping it's trying to. I have a few more people.
Quite a few of us.
Yes.
Okay.
6 from Madison, Wisconsin, and 2 of us from Madison.
They're supposed to be coming.
Really? Who? Marsha.
Oh, yes. We're supposed to have another. Yes.
That's true. Well, thank you for coming all the way out to be speakers.
It's nothing compared to all you've done.
Oh.
Honestly, we are so grateful with the PNHP crew. Thank you.
No, I was looking for food because then we did for Health Justice Week. We had a flag memorial going on the Washington Monument.
That's right, because you were asking
so
for volunteers to guard the flag.
And then I also had to do all the permit stuff.
Stand up now. We can't wait for long. It can be healed and transformed. That's right. Everybody in, nobody out. Let compassion be the norm. Yeah. Love is universal. So care is universal too. Yeah. Love is universal. Have a heart. Everybody have a heart. Oh, yeah. Everybody in, nobody out. We're mad as hell. Gonna let them know right now. Put that finger in the air like this. Let them know. One payer, single payer, Medicare for all. Healthcare is a universal right. One love, one people, one plan that'll cover every woman, man, and child in this nation. Let them know. No matter what they decide right now, we're not going to stop until they make the right decision. Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out. Thank you. Civil disobedience.
We're here at the rally of the Mad as Hell doctors, and I think it's time for the Mad as Hell Americans. We're getting a bamboozled job in Washington, D.C. right now, where we're about to see a bill called healthcare reform that's really going to be an insurance company giveaway of hundreds of billions of dollars a year in new revenue coming from working Americans who have had stagnant wages, who fear bankruptcy, who fear unemployment, who in many cases can't even put food on the table. They're going to be forced to buy overpriced insurance. It's time for us to say no to this. We started a project that I hope you'll come visit on the web, mobilizeforhealthcare.org, mobilizeforhealthcare.org. And it's a project that's trying to hold the insurance industry accountable by saying to them, no more denials of care. People are literally dying because the insurance companies don't want to pay for care that doctors tell them the patient needs. The insurance company intrudes and says, no, we're not going to pay for that. In fact, a study by the California Nurses Association just in the last month showed 20% of the time the insurance company says we're not going to provide care. People are dying who have insurance in the United States, and it's time to end that. And that really highlights the key point, which is these insurance companies are not the solution to the healthcare crisis in America. Putting hundreds of billions of dollars more into this inefficient, ineffective, profit-driven system is not going to solve the healthcare problem. We need to remove profit from health coverage. We need to have a system of payment, a single-payer system that's not in to make profit, but instead to make sure that people get provided the care they need. And this mobilizeforhealthcare.org is an effort to really transform the country, to get people active, get people empowered, so we can really end this system of abuse, which is this for-profit, multi-payer, health insurance-based system.
Thanks, Kevin. The people who can't ignore that we shall reap what we sow, so we better sow carefully. Abraham Lincoln proclaimed, we are a government of the people, by the people, and for the people, not of the corporation, by the corporations, and for the corporations. He also proclaimed, you can fool some of the people all the time and all the people some of the time, but you can't fool all the people all the time. Shake it up, America. Our government is a buying for we the people who can't ignore that we shall reap what we sow, so you better sow carefully. Go on, everybody. Wake up. Shake it up, America. From north to south, from east to west, from sea to shining sea. Government is a buying for we the people who can't ignore that we shall reap what we sow, so we better sow carefully. Sing a pair. Shake it up, America.